Bismillahirrahmanirrahim. Assalamu alaikum dear students. My name is Dr. Hira and I'm your course instructor of therapeutic exercises and techniques. As you know that the final term examination date has been announced by the examination department, and your final term examination they will be starting from the 8th of June after the 2 weeks um, when the Eid holidays will be over. So, and right after the Eid, the mock examination from the 1st of June they will be conducted, and before that we have to finalize the syllabus, and we are towards the end of the course. We have just chapters left behind, and those two chapters they are very much easier and they are not so lengthy chapters. One is related to the hydrotherapy and other one is related to the aerobic exercises. They are simple, they're very much simple and very much easy chapters. So inshallah we will go through those topics in the next lectures as well. But the new chapter that I am starting is related to the management of the impaired balance. So, and if we talk about the lecture that we discussed, the things we were discussing in the previous lectures, we were discussing about the resistance training exercises, in which we saw the forms of the resistance training exercises. We discussed manual and the mechanical resistance training. We saw some strength training adaptations. We discussed about the muscle development, the muscle performance, the types of the isotonic or the isometric, the static and the dynamic muscle contraction they were seen. So that was about the resistance training. And in the lecture that has been planned on the coming Thursday, inshallah, we will have a in the interactive session we will conduct a quiz, and afterwards will have a interactive session on that lecture, on the chapter. So if you will have any query, then you can ask me over there. Otherwise, we are starting with the new lecture today, the new chapter today, and the name of the chapter is Exercises for Impaired Balance. What is balance? What is a postural control? What is the posture? And what are the types of the balance? These things are not new for you because these things already have been discussed with you in the ergonomics in the biomechanics section. So we will focus here in this chapter, in this lecture, we will focus basically on the management of the impaired balance. If the person is presenting to you with the impaired balance, and how you will assess the impaired balance, and after the correct assessment and after the diagnosis of the impaired balance, how you will advise or how you will guide him the exercises, what will be your plan of care for the patient, what will be your strategy for that patient. So we will see that thing in the detail in this lecture. So let's start today's lecture. What are the learning objectives of today's lecture? At the end of the lecture, you will be you will have a good understanding about the balance of the body. The key terms and some definition we will just just go through those definitions. What is balance control? What is the impaired balance? What is the management of impaired balance? How you can assess and examine the impaired balance? What is the evaluation criteria? What are the specific tests? How you can go for the balance training, and what are the role of some specific exercises, and what are the health and environment factors that we can address. So let's start with today's lecture. Okay, well, what is the basic summary or the basic concept behind this chapter? So it is said that loss of balance and falling, they are always the basic problem that affect individuals with a wide range of diagnosis. So physical therapists, they commonly evaluate balance and they use balance training exercises as a treatment, as a plan of care. They can use those balance exercises either as a primary or as a secondary intervention for the patient who are suffering from the impaired balance, or something. If they are presenting to you with any abnormality, any pathology, or any impairment along with the balance abnormality or the balance impairment, then in the treatment or in the plan of care or in the rehabilitation program, how you can incorporate some balance exercises. So the purpose of this chapter is to present the overview of interventions for enhancing all the aspects of the individual's balance control. So first of all, let's see the definition of balance. Balance is a generic term which is used to describe the dynamic process by which the body's position is maintained in always equilibrium. So the state of the equilibrium is known as the balance. So if we talk about the body balance, so the body balance will be the position in which the body's position is maintaining the equilibrium. And what is the equilibrium? That if the body is moving, then it must be in the dynamic equilibrium, and if the body is static or it's stationary, then it must be in the resting position, then it must be in the static equilibrium. And balance is greatest when the center of mass or the center of gravity is maintained over the base of support. We have discussed these things already in the kinesiology and in the biomechanics. What is the center of gravity of the body, and what is the center of mass? What is the base of support? Base of support is in the lying position. This is your back. If you're standing position, then the area between the lateral border of the feet, that will be the base of support. The area that is supporting you, or that if you define the base of support, this is the perimeter of the contact area between the body and its support surface. So the foot placement that alters the base of support and that changes a person's postural stability. And in the wide stance, such as seen with many elderly individuals, it increases stability, whereas in the case with the narrow base of support, such as in the tandem stance, this is the tandem stance, okay, or the walking, it reduces the base of support. So as long as a person maintains the center of gravity within the limits or the base of support, it is referred to as the limits of stability. He or she does not fall, okay. So base of support was about the contact area between the body and the surface. And what is the center of gravity and what is the center of mass? We always know that if we talk about the center of gravity, it lies in the vicinity of the second sacral vertebra always. So what is the definition of center of gravity? The center of gravity is referred as the vertical projection of the center of mass to the ground. Okay, if this is the body, then the center of mass and the vertical projection, this is the center of gravity. Okay, and what is the center of mass? We always know what is center of mass. It's a very easy term. This is the point in which the equal, where the body is in equal position, it is in equalized position, it is in the equilibrium state. Okay, so the center of mass is a point that corresponds to the center of total body mass, and this is the point, the final point where the body is in perfect equilibrium. Okay, so this is let's suppose that this is the body and this is the mass central, this is the overall, the uniform mass. So the maximum point, the center of the mass, that will be at this point, and if it will be deviated towards this or this, then the body will not be in the equilibrium static. It will not be in the static equilibrium, or it will not be easy for the body to maintain, its position. So the center of mass is a point with the body's perfect equilibrium. And how you find out the center of mass? It is determined by finding the weighted average of the center of mass of each of the body segment. Okay, so we have to go through these definitions because we have to just revise this definition. So as we are following the chapter sequence, so after the definition, there comes a balance control. We always know that there is some nervous control, there are some nervous system involvement, there is musculoskeletal involvement, there is contextual factors involvement in the maintenance of a specific posture in the balance control. So balance is always a complex motor control task which involves the detection and integration of sensory information to assess the position and the motion of the body in space and the execution of appropriate musculoskeletal responses to control body position within the context of the environment of the task. So the nervous system, the sensory processing, the sensorimotor integration, and then comes the musculoskeletal involvement, the involvement of the proprioceptors, kinesthetic sensation, the muscle involvement, the muscle flexibility, the muscle control, and then comes the contextual factors, which involves the environmental conditions, and the complexity of the task or the complexity of the activity, in which you have to maintain your body balance. So balance control, it requires interaction of the nervous and musculoskeletal system and contextual effects. So this is a diagram through which you can just revise the balance control mechanisms. First of all, if you see, this is a musculoskeletal system. What it involves, it will involve the sensation part, The postural alignment, the range of motion, the flexibility, the joint integrity, and the muscle performance, they all are integrated to form the musculoskeletal control, the musculoskeletal component of the balance control, and it will coordinate with the nervous system. And what are the components involved of the nervous system in the balance control? It involves the sensory processing. If you see the cursor, it involves the sensory motor integration, the motor strategy, the anticipatory mechanisms. This is the nervous mechanism, and they will be, coordinating and the systematic coordination with the musculoskeletal system and the nervous system. The contextual factors that involves environmental factors, the support surface, the lighting, the gravity, what the nature of the task. So these all the factors, they will combine, lead to the balance control. So if you're walking on a slippery surface, if you're standing in the bus in which you are currently who is having very high speed, or you are standing at a single leg. So all of these positions, there will be separate involvement of the, because all of these are the different nature tasks. So in all of these, there will be a coordinated movement, there will be a coordinated mechanism behind the balance control. So from here, there arises the concept of the balance control. And in the case of the impairments, or in the case of any abnormality in these control mechanism, it will lead to the impaired balance. Okay, so first of all, we have to see the types of balance control. Afterwards, we will discuss about the impaired balance. So what are the types of balance control? Always there are the the resting type, the movement. They are the things we have been going through since we have been in the we have studied the physics. So in the static balance, the type 1 of the balance control, this is the static balance. Static balance is to control, to maintain a stable anti-gravity position while you are at rest, such as when you are standing, when you are lying, when you are sitting, when you are maintaining a single position. That is the static balance. Okay, then comes the dynamic balance. Dynamic balance, this is the kind of body balance when you are switching your position. So dynamic balance control to stabilize the body when the support surface is moving, or when the body is moving on the stable surface, such as you are transitioning between the sit to stand, or you are standing and you are sitting again, and or you are transferring, you are walking, or you are crossing some obstacles in the environment. So anything in which you are changing your position, or you have to go through some transition. That will be the dynamic balance control. In that portion, there will be the dynamic balance control. Then comes the reactive or automatic postural reaction, in which you have to maintain balance in response to unexpected action or external perturbation. All right, so we know that every action has a reaction. So if you get an action, then obviously your body will react in some way. Then during the maintenance of that reaction or automatic postural reaction, the kind of balance involved will be the reactive balance control. For example, standing on a bus that suddenly accelerates forward. Okay, जिसमें हम कहते हैं कि मुझे झटका लगा, तो उस झटके में किस तरीके से हम अपने आप को सीधा खड़ा रखते हैं, किस तरीके से अपने आप को सहारा देते हैं. That will be the example of the reactive balance control. And the last but not least, here is the anticipatory balance control. That is the thing in which we will be talking about some some expected or some unexpected things that can be faced when we are accomplishing a task. So for example, you have to walk between the obstacles. You have to follow a specific pattern during the walk. You have to place 1 foot over here, then on the other spot, on the one spot, on the other spot. So anticipatory control involves the activation of postural muscles in advance of performing skill movement, such as activation of posterior leg and back extensor muscles prior to a person pulling on a handle, or when standing or planning how to navigate to avoid obstacles. For example, आप चल रहे हैं और सडनली आप देखते हैं कि सामने फर्श पे या किसी सरफेस पे ऑयल गिरा हुआ, तो आपने उस ऑयली फ्लोर पे से कैसे गुजारना है खुद को विदाउट फॉलिंग. If that is anticipatory control, जिसमें आपको which is unexpected condition भी face करनी पड़ जाती है. Sometimes that can be expected and most of the time that is unexpected. So the static balance control, balance maintenance in a single position, dynamic balance control, balance control during the transition sum of the movement, the reactive balance control in which you have to maintain the balance in response to some unexpected condition, but उसमें posture involvement जरूरी है, और anticipatory conditions में sorry, anticipatory condition as anticipatory react control, when you will be talking about some some skill movement you are performing, or some kind of expected unexpected condition face करनी पड़ रही है, तो how you will manage to control your balance. Okay, so that is about the expectedly or the anticipatory control. You will talk about that. Okay, then comes the balance impairment. So obviously what is the balance control? Abnormality and some any abnormality in that balance control that will lead to the arising of the balance impairment. So impaired balance, it can be caused by injury or disease to any structure that is involved in the 3 stages of information processing. For example, that involves obviously the nervous control, the sensory processing, the sensorimotor integration, and the motor control. Okay, the sensory input impairment, if we talk about that can involve the proprioceptive deficits following lower extremity and trunk injuries or pathologies. That can involve decreased joint position senses in individuals with recurrent ankle sprain. That can be seen in the patient with the knee ligamentous injuries, degenerative joint diseases, and low back pain. And these same conditions have been associated with the increased postural sway. Somatosensory, visual, or vestibular deficits, they may impair balance and mobility. Reduced somatosensation in the lower extremity, which can be caused by peripheral neuropathy in the aged and the patients of the diabetes. The persons with the visual loss, individuals with the damage to the vestibular system due to viral infection, due to traumatic brain injury, or aging, or the patient who has complaint of the vertigo. So they are the condition that can lead to the sensory input impairment, and when there will be sensory input impairment, there will be subsequent loss of the sensory processing, and that loss will lead to the impairment in the balance control. Okay. Then is the sensorimotor integration impairments. So damage to the basal ganglia, cerebellum, or supplementary motor area in case of any injury, it can impair your processing of incoming sensory information, resulting in difficulty adapting sensory information in response to environmental changes and in disruption of anticipatory and reactive postural adjustments. Okay, if we talk about the biomechanical and the motor output deficit, then the deficits in the motor components of the balance control, they can be caused by musculoskeletal components, for example, the poor posture, for example, the joint range of motion restriction, decreased muscle performance, or impaired motor coordination, pain, and some other impairments related to the musculoskeletal system. They can also lead to the motor output deficits. And the postural malalignments, such as the typical thoracic kyphosis, these are the conditions, eventually they can lead to the shifting of the center mass away from the center of the base of support, so that can exceeds the limits of stability. So, and if we talk about the deficits with the aging, then the most falls by the elderly are due to because of the very complex interaction between the multiple risk factors, and those risk factors are muscle weakness among the elderly, history of fall, gait deficit, balance deficit, use of assistive devices, improper use of assistive devices, visual deficits, arthritic changes in the joints, impaired activities of daily living, depression, cognitive impairment, age over the 80 years. So these are the risk factors through which they make elderly person prone to the fall or the impaired balance. And the deficits from the medication, all the medicines who can lead to the sedation, the antidepressants, hypnotics, tranquilizers, antihypertensive drugs, the drugs who can cause a dizziness, or sometimes antihypertensive, they can also lead to the some kind of dizziness that can indirectly lead to the fall or postural instability or loss of balance. And also it is said that the concept behind the orthostatic hypertension, when you're lying for a longer time and then you suddenly get up and then you feel dizziness, that can also lead to. But these things are not, the permanent impairments. They are not the permanent impairments. They are just, there can be some physiological responses as well. So the systems that are controlling your balance, including the nervous system, the sensoromotor integration, the sensory part, the motor control part, the musculoskeletal system, your joints, your receptors, your muscles. So all the systems, all the controlling mechanism who lead to development of the good body balance in case of any abnormality, in case of any impairment, in case of any disease that can involve these controlling mechanisms, any kind of trauma, any kind of injury, any kind of infection to these, systems, any kind of deficits, anything that can, disrupt or, that can damage or that can affect our balance controlling mechanism, any component of balance controlling mechanism, if that will be involved, if that will be affected, then the overall body balance will be affected, because the body controlling mechanism, they are working coordinatedly in order to support your body, in order to support your postural stability. When you're walking, when you are running, when you are, maintaining a position, when you are sitting on the gym ball, or when you're doing any task. So they are the controlling mechanisms actually. Okay, ji. So balance assessment. Okay, ji. So the basic thing starts from here. So we're suspecting a person that he or she is having some kind of impaired balance, and how to assess the balance. Okay. So if there are 4 types of balance, then we have to assess every type of balance with specific type of test. So every, that in the balance assessments, before starting the balance assessment, we will go through the same sequence, starting with the history, and afterwards, the specific assessment. And here we will discuss the balance assessment. So we will see the different tests. The 4 type of balance will be assessed through separate type of test. Okay, so in the balance assessment, first of all, there will be static balance test, through which we will test the static balance. So in the static balance test, there will be, first of all, there will be the single leg stance, in which you can see the position of the patient. You can ask him to stand on the single leg, or you can ask him or her to keep your shoulder in the 90-degree flex, or like this, or otherwise you can ask them to place their shoulders like this over here, or you can ask them to place their shoulders or place their arms on the anterior superior iliac spine, and then to maintain the single leg stance. And afterwards, after making the single leg stance, you can ask them to stand for 30 seconds, for 20 seconds, for 40 seconds, depending upon how much time you want to give them. Single leg stance, so you can ask them to stand on the single leg. You can repeat the test for the both tests, and if you want to make the test complex, then you can increase the duration, or you can ask them to close the eye in order to make it complex. Or you can, if you want to make it more complex, then along with the visual disconnection with the closed eye, you can ask them to stand on some some other surface. For example, you can give some cushion under their feet. So you can complex the test by adding up these things if you want. So this is a single leg stance. Okay, the test first is, then there comes sorry. Then there come the Romberg sign. Romberg sign, this is a type of test which is used very much commonly in the European countries to assess the alcoholic state of the driver, if they're suspecting that person is driving with after the alcohol intake. So in the Romberg test, what to do, we have to ask the person stand with the feet together for 30 seconds for up to 1 minute. So that will be the Romberg test and the Romberg sign, and it is usually involved in the when we are talking about the cerebellar lean, then we used to ask them for the Romberg test. So this is the Romberg test. Okay, and then you can go for the tandem Romberg test, and in the Romberg test we were asking him or her to stand with the feet together, or if you want, then you can increase the base of support to make the test more complicated. Okay. And if you want to go for the next test, the tandem Romberg test. In the tandem Romberg test, you can ask them to stand in the with the eyes closed like this, with this position. Okay, that will be the tandem Romberg test. Okay, so this is a tandem Romberg test. One feet on the other on front, on the other feet on the back, and again you can repeat it with the left feet on the front and the right feet on the back. You can repeat it. Okay. So this is the tandem Romberg test, or in the feet. If you see the diagram, in the feet together with the Romberg test, semi-tandem with the half tandem position in the tandem position in the up and back. Fine. Okay. Then comes the stroke stand test. This is again a very simple test in which we can assess the static balance of the body. In the stroke stand test, we ask them to stand on the single leg with the other leg crossed and placed on the lateral or the medial side, on the I must say on the medial side of the knee, like in this position she's standing. So, and with the hands, with the both hands standing, resting on your iliac crest. So this is the stroke stand test. If you want to make this test complicated, then obviously you can ask them to close your eyes and to maintain the position. Okay, for 30 seconds or up to 1 minute. This is about the assessment test for the static balance. Then comes the dynamic balance test. Very simple test. You can go for, as always, the walk test. There is the walk test. You can ask them to walk following a line pattern, or you can ask them just to go towards that point, or just go towards the door, or you can ask them to change your position from sitting to standing, from standing to sitting, 5 times sit to stand test. If you want to make the things different, then you can ask them to modify the positions of the upper limb. Either you can ask them to place them here or here or here, okay, but without support of your the support of the support of your muscles of the thigh, or without that thing. So person has to stand by herself or by himself. So 5 times sit to stand test or the walk test, they can be used in the assessment of the dynamic balance. Then comes the anticipatory test. The first test is the functional reach test. The patient will be standing on the fixed position, and you will ask him or her to touch that point without moving your leg, without moving your feet. From that point, you have to touch that position. You have to touch that point. So you have to just lean forward and touch to that point. All right. So if that is a functional reach test, he or she has to lean forward, and he or she cannot move her feet from that point. This is the functional reach test. And if you want to make it complex, then you can ask them to lean backward. That will be the backward leaning, in which you can ask them. The functional reach test will be converted into multi-directional reach test when you will ask them to lean backward, or you can ask them to lean towards the side. Okay, so forward, backward, and the sideways. Okay, that will be the multi-directional reach test. Then comes the star excursion balance test. In the star excursion balance test, what we will do, we just make a position. What we do, if I see you making over here in the star excursion test, I don't know either it is visible to you not, then you can see over here that just like this, we will draw a star over here. Okay, like this. This will be the interior, this will be the posterior side. So this will be the medial and the lateral. So this will be the anteromedial, this will be the anterolateral, and this will be the posterolateral, and this will be the posteromedial. Now the person with the single leg will be standing over here, and leg will be the fixed, the foot will be the fixed, and with the second leg or the second foot, he or she has to touch the supports on these points. And similarly, on standing on this leg, he or she has to touch these points. Okay, so this is the star excursion balance, in which you have to touch the points or the supports on the different rows first of all, on the right side with this leg, and on the left side with this leg. Okay, this is the start execution balance test. The diagram is here. Then comes the test of the reactive balance. Reactive balance, in which always we test you after the pushing and pulling the patient. So the first test is the push and release test, in which the patient will actively pushes back while the clinician allows in a front movement to create the unstable stance position and the removal of the counter pressure, where the clinician requires the patient to take a step to regain the balance. Okay, so the push and release test, and similarly you can go for the pull test, in which what you will do, you will be standing behind the patient and you will just pull her slightly in order to see how her body will manage to maintain the balance. Okay, so push and the pull test. So this was about the balance assessment. So this is these specific tests. You can go for the balance assessment if you're suspecting the balance impairment in the patient suffering from any kind of thing that has involved the balance loss. So you have to go for the balance assessment. So now we have assessed the balance, we have taken the history, we have finished our examination portion. So now what to do for the balance training? So obviously, we being the physiotherapist, we have specific regimes through which we can train the balance exercises. We can train them towards the rehab, towards the restoration of the body balance. So the balance training, there are many factors to consider when developing an intervention program for balance impairment. And most balance intervention programs, they require a multi-systems approach. For example, an individual who has experienced prolonged bed rest or inactivity following an illness, it may require a program that includes stretching the lower extremities and trunk to improve postural alignment and mobility, strengthening exercises to improve motor performance, and the dynamic function balance activities to improve the ability to perform daily activities. If that means that it is want to say that along with some other specific regime that can involve the stretching, that can involve the strengthening mainly, and after addition of those specific regimes or the local muscle regimes or the local muscle exercises, you can add up the balance exercises. And always remember that the sequence will be the same. If the person is not able to maintain the static balance, then we will start with the static balance exercises. If the person is not able to maintain the dynamic balance, then we will add up the static and the dynamic balance exercise. The person is not able to maintain the anticipatory balance, then starting from the static and the dynamic and then towards the anticipatory. And if the person is not able to maintain the any kind of balance exercise, then we have to progress the balance exercises in order to maintain the body balance and the postural stability. All right. So always remember, there are some kind of specific exercises through which we can, learn the patient. We can re-educate. We can relearn them. Balance control. Always remember that the procedures of the test that we have discussed, they were in the assessment portion, that those procedures of the test, they can be incorporated in the form of the exercises. For example, the patient is not able to maintain the transition of the standing to sitting, then you can make that procedure or that thing as his exercise. So you have to just repeat it: stand, sit, sit, stand, stand, sit. That will be the exercise. Okay, if the person is not able to maintain this position like this, and you have to ask him to practice it daily, that will be his exercise. Okay, you can make the things more complex by progressing, by increasing the repetition, by addressing the base of support, by increasing that by increasing some other, you can, by adding some other challenges, you can do some other the progressive things if you want to add up. Okay, so so let's start with the balance control. Obviously, first of all, we will discuss about the static balance control, so that there are some specific exercises, and the procedures or the exercises can be derived from the assessment test as well. So in the static balance control, how to train the static balance control? The activities to promote static balance control, they include having the patient maintain sitting position, half kneeling position, tall kneeling position, and the standing postures on a firm surface. Okay, if you want to make it more challenging activities, then you can include the practicing these positions in the tandem position, or you can ask them to practice these positions with the single leg stance, or you can ask them to practice the position with the lunges, with the squats, or you can ask them to, you know, stand on the some unbalanced surface. For example, you can ask them to stand on some cushion rather than standing on the firm surface. You can ask them to close your eyes. So this is how you can, you know, add up the various exercises. And if you want to progress the activities by working on the soft surfaces, for example, foam, sand, grass, you can narrow the base of support, you can move the arms, you can close the eyes, you can provide resistance via handheld weight or elastic resistance or additional resistance you can ask them to carry during the task accomplishment, or you can add a secondary task. For example, you can ask them to catching a ball or mental calculation during performing the task to further increase the level of difficulty. So this is how you can ask them to train for the static balance control. Okay, and always remember, all these exercises, they have to be done under the supervision of the physiotherapist or the supervision of the home attendant, because all of these, the patient who are suffering from the loss of the balance, loss of the postural stability, they are very much prone to fall, and we have to, you know, always make them do the exercises under the strict supervision. Okay, they must be away from some sharp object. If you want to use a safety belt, then you can use a safety belt, and you have to make them do the balance exercises with a great precision, and with the, you know, with the starting from the simple and then towards moving towards the difficult positions. Okay, so you can see the diagram over here. This is here, she is practicing the tandem stance. She is standing with the catching a ball, throwing and catching a ball in this position. They're also using a handheld dumbbell along with standing position, and there they are using the pulley. So this is how you can make these exercises complex. Okay, then comes the dynamic balance control. To promote dynamic balance control, treatment may involve have the patient maintain equal weight distribution and upright trunk postural alignment while on moving surfaces, such as sitting on the therapeutic ball. You can ask them to sit on the therapeutic ball in order to maintain the balance. You can ask them to stand on the wobble board or bouncing on a mini trampoline. Okay, in the static balance control, she or he was standing on the firm surface. All right, and in the dynamic balance control, you can ask them to stand on the wobble board. Now, what is a wobble board? Wobble board is actually a board which has a pivot on the lower side, so it is not easy to maintain the balance on that. So this is a wobble board. Okay, this is a wobble board, and this is a mini trampoline. So you can use the wobble board on the mini trampoline during the standing exercise when you want to, you know, learn them how to maintain the equal weight distribution and how to maintain their balance while standing with the equal weight distribution, along with the postural alignment. Okay, you can progress activities by superimposing movements such as shifting the body weight, such as rotating the trunk or moving the head or arms, while same time they are standing on the wobble board, or they are bouncing on the mini trampoline, or they are sitting on the therapeutic ball. Okay, you can vary the position of the arms from out to the side to above the head. You can practice stepping exercises starting with small steps, then mini lunges to full lunges. You can progress the exercise program to include hooping, jumping, rope jumping, skipping, or hopping down from the small stool while maintaining the balance. So all of these things in which, you know, you can add up the variation of the movement. You can add. Have the patient perform arm and leg exercises while standing with the normal stance, with the tandem stance, and with the single leg stance. Okay, like this, and standing on the single leg. So all the transitioning movements, they can be added up in order to enhance the dynamic balance exercise. Okay, so this is the wobble board and the mini trampoline. You can see here the person is practices standing on the wobble board. The person is practicing standing on the wobble board along with the forward leaning. Here he is standing with the upright posture. Here he is leaning forward in order to maintain the balance. Here again you can see, okay, they have targeted the upper limb position. So this is how you can ask them to vary their positions. Okay, So this is the things you can go for the balanced exercises, but they must be supervised in any case. Okay. Then comes the anticipatory balance control. In the anticipatory balance control, you can ask them to reach in all the directions to touch or grasp objects such as catching a ball, kicking a ball. You can ask them to use different posture for variation, for example, sitting, standing, kneeling, and throwing or rolling the ball at different speeds and heights. All right. So in the anticipatory balance control, you can add up some tricky tasks while maintaining their balance. You can use functional tasks that involve multiple parts of the body to increase the challenge to anticipatory postural control by having the patient lift objects of the varying weight in different postures at varying speeds, open and close doors with different handles, and heaviness or maneuver through the obstacle course. So you can ask them to do these tasks, and if you want, then you can increase the complexity of these tasks. Okay, and on the last, there is the reactive balance control. In the reactive balance control, obviously we have to train the patient according to the reactive balance, and we can add up these activities. You can have the patient work to gradually increase the amount of sway when standing in different direction while on a firm stable surface. You can ask them just to increase the amount of sway, like here, here, or the here. Okay, and now you will see how he or she is able to maintain the balance. To emphasize training the ankle strategy, the patient practice while standing on one leg with that one, correct? To emphasize training on the hip strategy, have the patient walk on the balanced beams or the lines drawn on the floor. You can ask them to perform tandem stands or single leg stand with trunk bending. You can ask them to stand on the mini trampoline, rocker balance board, or the sliding board as well. All right. To emphasize the stepping strategy, have the patient practice stepping up on the stool, stepping with the legs crossed in the front or behind the other. For example, you are breathing or the waving or through your legs. And if you want to increase the challenge during these activities, you can add anticipated and unanticipated external forces. Okay. For example, you can ask the patient to lift boxes that are identical in appearance, but they can be of different weights. You can throw and catch balls of different weights and sizes. You can ask them to do, when they are on the treadmill, if they're using the treadmill, then you can suddenly decrease the speed of the on the treadmill. So this is how you can add the complexity. So you can add up some actions. They can be expected or they can be unexpected, and through which you can increase the complexity of the task. Similarly, you can add some balance exercises in the functional activities. The therapist should focus on activities similar to the functional limitations identified in the evaluation. For example, if reaching is limited, then the patient should work on the activities such as reaching for a glass in the cupboard, reaching behind as putting arm in the sleeve, or catching a ball of center. So we always remember that the functional activities, they are very much important. They are of immense importance in the rehabilitation program, as they make the patient learn the exercises more quickly as compared to the on-session exercises. So you can ask the patient to have the patient perform 2 or more tasks simultaneously. That can increase the level of task complexity. Or you can ask the patient to practice recreational activities when the patient is enjoying, for example, playing the golf, or through this you can increase the motivation for the practice while challenging the balance control. So you can see over here. Okay. So this is how you can increase the complexity of the task. Safety during gait, locomotion, and balance, it must be emphasized. To emphasize safety, the therapist should have the patient practice postural survey activities within the person's actual stability limits, and you have to progress dynamic activities with emphasis on promoting function. And if balance deficits cannot be changed, then the environmental modifications, assisted devices, or increased family external support, they may be required to ensure the safety. And if you talk about the environmental modification, you can see the lighting of in the room of the easy surfaces or the firm surfaces must be there. There must not be some kind of slippery or uneven surface. There must not be uneven mattresses in that room. The person must be knowing how to correctly use the assistive device. So these are the things, and obviously the motivation, the family support, they are the things that can make the things easy for the patient suffering from the balance problem. So this is how you can and if there are some health issues, for example, the patient is, or if he or she is having low BM, then you can address that issue just by changing the glasses of the patient. And if there are some, some things in the room that can lead the patient towards the fall, then you can then you can remove such factors in that area. Okay, so these are the things you can, you can go for this. There are some group of exercises known as the Tai Chi exercises. They are used, they involve the balance and the posture exercises, and they are practiced very much widely, and they resemble some kind of yoga. So those Tai Chi exercises, I will share the video with you. Those Tai Chi exercises, they address your body positions, and they use the modified body position in order to maintain to learn how to maintain this position, and how to maintain, a different complex posture formation. So that I will share the video with you of the Tai Chi exercises, so just have a look at that. So this is how you can maintain the balance control of the body, and how you can learn them to do the balance controlling exercises. This is not a difficult topic, a very easy topic, but you have to memorize the exercises. In the static portion, for the static balance, you have to make them learn the exercise in the single position, but you can make them complex just by increasing the the difficulty at the eye level, or the upper limb or the lower extremity level in the dynamic position. In the dynamic balance control, you have to make the exercises with the switching, transitioning position. In the anticipating and the reactive, you have to, design the subsequent exercise. So this is about the um, balance control exercises. If you want to ask any question, then inshallah we will discuss these things in um, the interactive session, inshallah. Thank you.